Coming up on the Get Lean, Eat Clean podcast.
When I speak abroad, everybody wants to compare their healthcare system to the United States. And my response is pretty much the same. In the acute phase, trauma care, I
Yeah,
would not want to be anywhere other than the United States
right,
or that.
right.
If I'm going to get shot, I want to get shot like in downtown Detroit or
Right.
or the Bronx, where I'm originally from, because I know that those physicians in those ERs, that's their daily bread. They know what to do, they know how to do it. They're emergent, acute care, there's no one better. Now, when it comes to chronic or long-term care, that's where we as a nation have dropped the ball. We are in sick care, not health care. And that's where we as a nation need to step up and do better.
This week, I interviewed Dr. Joseph Rosado. Dr. Rosado is one of the most well respected scientists working with medical cannabis. He's also an educator and published author. We discuss the healing potential of medical cannabis, CBD, and ketamine therapy, along with how medical marijuana can help with anxiety, depression, and insomnia, Dr. Rosado's protocol to healing and getting off prescription drugs, myths of low T, helping kids with ADHD, and his one tip to get your body back to what it once was. Really enjoyed my interview with Dr. Rosado. I know you will too. Thanks so much for listening and enjoy the show. All right, welcome to the Get Lean, Eat Clean podcast. And I have on today's show Dr. Joseph Rosado. Welcome to the show.
Thank you very much. Thank you for the invitation. Thank you for having me.
Yeah, my pleasure. All the way from Florida.
Where it's much warmer than where you are, I believe.
Yeah, although we've had a nice fall here, I will say. I'm not complaining.
It was 94 today. Can you
Oh,
top that?
yeah, no, we're happy in the 50s right now.
Yeah, it was not, I got in my car today because I had the mechanic and I get in my
94.
vehicle and it was 94 degrees. I'm like, what the heck? I
Mm,
had my AC ranked down to like 65.
yeah, Jesus. Yeah, my parents are in West Palm, like Delray area. So
Okay,
I
yes,
get
I'm
I, I
familiar.
I get the weather updates quite a bit.
Especially in the next few months when you guys are up to your hips in
Oh,
snow.
yeah, yeah, yeah. That's true. That is true. Well, I'm glad to have you on. You're an author. You've been in medicine for quite a while. Alternative medicine, shall we say, medical cannabis, HRT, and excited just to talk to you about sort of the healing that's brought to you and the individuals that you help.
Absolutely. Be my pleasure.
Well, maybe just give like a brief background of what got you into alternative treatments, and I know it's had a personal experience on yourself, and then with your clients and stuff, how you just got into that.
Absolutely. So prior to being a medical doctor, I was a chiropractor. And what caused me to go to chiropractic school was because I was involved in a severe automobile accident. I was stopped getting ready to make a left-hand turn. This was 1987-ish. And I was driving a Datsun 210, B210. So this was before Nissan existed. So
Mhm.
before Nissan was Datsun. And a 16-year-old boy was drinking a milkshake and was driving his dad's Delta 88. And he dropped his milkshake, bent forward to pick it up. When he went to pick it up, he left his foot on the gas. And when he came up, my
Right.
vehicle stopped his vehicle.
Mm.
I lost, obviously, because he was in this massive boat.
Yeah.
And that caused a compression fracture of one of my vertebrae, my spine, causing me to have initially what's called spinal shock. The spine and the trauma caused major swelling and inflammation in and around the area where the trauma was. And I lost movement, feeling, and sensation from the waist down, from the belly button down more so. And within 24, 48 hours after having received massive doses of steroids and traction, I started getting kind of pins and needles. And I was told by the orthopedic surgeon, well, you're as good as we're going to get you, so we're done. And I went to see a chiropractor who I had seen for a sports related injury a few years before. And when he took the x-rays, he was the one that told me about my compression fracture. It was not seen in the hospital. And again, this was 1987 where MRIs were there, but not really there.
Mhm.
And so 2 weeks after the accident, I was feeling much better than I was before the accident. And I was pre-med, getting ready to go to medical school, changed directions and went to chiropractic school instead. Learned a lot about, musculoskeletal, natural healing arts, Reiki, all kinds of alternative, what is considered alternative medicine, some acupuncture, and practiced for 5 years as a chiropractor, but then got frustrated with the limited scope of practice because of the inabilities to be able to do more for my patients. If I wanted to do, say, HRT, although the majority of the patients were open to it, I could not prescribe testosterone, estrogen, progesterone because they're prescription medicines or controlled substances like testosterone is. And so for that reason, I chose to go to medical school to be able to broaden my scope of practice and be able to manage and treat more people and help them naturally rather than relying and depending on synthetics. And so I went to medical school. Following medical school, I got involved in everything in and around medicine. And from 2010 through 2015, I started doing hormone replacement therapy for men and women exclusively. That was called stimulated by myself. I got involved with the American Academy of Anti-Aging Medicine, which are based here in Florida. And prior to going to the seminar, I did all the testing of myself. I did saliva testing, I did the blood work, checked all of my hormone levels. And one of the individuals that was speaking was a gentleman in Michigan that does men's health. And as he's on stage describing case studies, I'm sitting in the audience thinking, this guy's describing me, like as he's going through the symptoms and everything. And when he got done speaking, I made a beeline to him. But by the time I got there, there were about 10, 15 people around him. And he's answering questions and everything else. And there was like a quick break, I had my labs with me. And I pulled the labs out of my suit pocket and I handed it to him over everybody. And I said, what do you think about that patient? And he opened it and he looked at me and he said, this is you? And he saw my badge and he saw the name on the lab report. Like, yes. And he looked at me and looked at the labs and he looked at me again and said, been feeling kind of bitchy lately? And I'm like, that's an understatement. So he's like, we have much to discuss. I said, let me take you to lunch. So we went, had lunch. In that hour, he created an entire program for me, explained why he was giving me, what he was going to give me, how I was going to take it, when I was going to take it. And within 90 days, I was a completely different human being, not man, human being. I was just completely changed. And that's when I said, I have to extend this and broaden this and take it out further. Unfortunately, in 2015, some issues occurred in the state of Florida regarding alternative medicine and bioidentical hormone replacement therapy for men and women. And so I, at that time, shifted over because that's when things were moving in the medical cannabis arena. It was up for ballot in 2014. It didn't pass. We were going back again in 2016. So I got involved into the medical cannabis space, which in essence does tie in with a lot of the HRT things, simply because one of the main reasons men and women have issues hormonally is because they're under stress, they're having anxiety, they're not sleeping, they're depressed, their cortisol levels are off. And by being able to manage them without the use of benzodiazepines, if they are in chronic pain, without using narcotics, which we all know cause hypogonadism in men, and the antidepressants that cause anorgasmia or delayed orgasms, we figured, let me combine all of this and just come up with a full package. And so that's where I'm at. And that's what I've been doing.
Excellent. Yeah, thanks for explaining that. And what would you say the majority of the people that you see come to you for? I know you mentioned like high cortisol, lack of sleep, and how do you sort of navigate, medical cannabis and depending obviously on the patient and what they have, but how do you navigate that and decide what to use?
Well, the number one reason for patients coming to see me for medical cannabis is chronic pain, followed by anxiety, depression, and insomnia. So
Okay.
that's really my, number one and number two. And so will start by addressing the pain because that's what they're there for. And in conjunction with that, then I'll add other things to their treatment. So the idea of strains is really a misnomer because there are no strains in the plant world. You have a family, you have a species, you have a genus, species, subspecies, etc. And so knowing which chemovar to use is important, but more importantly are the percentages of CBD and THC, as well as the other phytocannabinoids. Understanding and knowing that we have an endocannabinoid system. We do produce cannabis. All vertebrates produce cannabis. Most people don't understand or know that. Less than 10% of medical schools educate physicians in medical schools on the endocannabinoid system and the fact that we produce cannabis. We have cannabinoid receptors that work in our body as we age or as we're stressed from dis-ease or chronic pain or anything else. Our levels are depleted. Also, with post-traumatic stress disorder, anxiety, depression, all those levels tend to drop as well. And so that's where you get a lot of the hormonal imbalances. And someone is in chronic pain, you're throwing narcotics at them, you're just adding fuel to the fire and making them worse, not better. And so initially I'll put them on something, to be used during the day in the morning, then midday, and then into the evening, combining not only the percentages of the cannabis, but also what are called terpenes. The terpenes are found in not only the cannabis plant, but also other plants. So linalool, which is found in lavender, limonene in citrus, beta-caryophyllene, which is found in black pepper. All those three are excellent for anxiety, depression, and insomnia. And combining all of that for the first 30 days, I leave them on their medications. I just add the cannabis to them. In the meantime, I'm getting labs done. I'm getting saliva testing, blood work, whatever needs to be done. Then when they come in after 30 days, I'll then review the labs, see where they are, get feedback on how they're doing. And that's when we start weaning off of the narcotics, weaning off of the benzodiazepines, weaning off the antidepressants. And then we begin the supplementation to get their hormone levels to a normal state and also aiding so that they can feel less anxious, their depression's under control, and they're sleeping better. Because contrary, the difference between men and women in depression, for example, when a female is depressed, generally speaking, they look sad. They look depressed. What depression to look or be like. They're crying, their eyes watery, they look like they're hungover. They're not all there. With men, they're angry. They're very, very angry, violent, aggressive. And it's because of how we've been raised to think and be. We're not taught to express our feelings. We're not taught to say, hey, I'm not feeling right, something's not right. And because we don't know how to deal with that level of depression or what that is, we become angry because we can't figure it out. We can't fix it. And that's what we do. I have twin daughters and three granddaughters and a grandson. And the way my grandson is versus my three granddaughters and my two daughters, navigating through that level of estrogen and my poor grandson, he's like, Grandpa, what do I do? So, so understanding that is important and being able to explain it, because once you explain it to, individuals, and my patients hear me say that, they're like, that really makes a lot of sense. No one's ever explained it to me that way. And then once we start supporting them and, raising their testosterone levels and, working on lowering their estrogen levels, that was my issue. My estrogen levels were higher than my testosterone levels were. Now, and they were, my testosterone levels were below normal. Had I gone to a regular conventional, urologist or primary care that dabbled in it, he would just give me testosterone and said, here you go. Not understanding that all that testosterone that I was receiving, I was converting to estrogen. And so it was making me worse and not better. And so that concept, that idea of being able to look at all of the hormones and looking at the cascade and the precursors and what came first and how everything works helps me to then be able to navigate and create treatment programs for everybody. Because like I tell all my patients, what we do is individualized medicine. It's not cookie cutter. You're not getting the same dose as, your neighbor. It's all dependent on what you're presenting, where your levels are, and where we want to get.
Yeah. A lot of good stuff there. As far as sleep is concerned, this is, I find a lot of clients aren't getting great sleep or they're getting up a lot
Mhm.
during the night, especially males are going to the bathroom. How can maybe on their own or with the help of a physician, someone like yourself, like use cannabis to their advantage as far as, helping them fall and stay asleep? And is it the same quality of sleep as it would be if they were just doing it on their own?
No, it's not the same quality of sleep. In fact, thanks to the technology that exists and everybody's having their little Fitbit, their little
Sure.
watches and they
Yeah.
monitor themselves. They come in and they show me where they were before they started treatment and where they were afterwards. And not only is it a matter of the chemovar, but you asked a really excellent question, falling asleep and staying asleep, because a lot of people that have issues with insomnia, you have to, I ask them, do you have trouble falling asleep or do you have trouble staying asleep? Some people have no problems falling asleep. They just wake up 2 to 3 hours later. Others toss and turn. They can't fall asleep at all. But once they do fall asleep, they're able to stay asleep relatively well. And so that's where I combine the modes of administration of the cannabis. So it's not, again, one size fits all. If you're having trouble falling asleep, then I'm going to give you something that's going to work relatively quickly. After suppositories, the next fastest mode of administration is inhalation. Whether you smoke cannabis cigarette, you do a vape, you do a dry vape, hit a volcano, do a nasal spray. In the state of Florida, we have meter dose inhalers that look just like an albuterol inhaler. Because when you inhale cannabis, you get the effect usually within 3 to 10 minutes, but it only lasts 2 to 4 hours. And so they're not going to be getting up every 2 to 4 hours to hit their pen or
Right.
their pipe or their bong or whatever. So in that scenario, I'll give them the inhalation, but I'll tell them to, at the same time, use an edible. Why an edible? Because an edible, we can titrate to effect. The standard dose is 10 milligrams. I have them cut it into 4 pieces. We start low, go slow. So they start at 2.5 milligrams, which is 1/4. But an edible takes about 2 to 3 hours before it kicks in the system. So when the effect of the vape or the inhalation is wearing off, the effect of the edible is kicking in. And so now you're covered better longer. So the inhalation got you to sleep, and then the edible is keeping you asleep. And that's the goal. Now, granted, I'm 62 years old, so I, still have on occasion, depending how much water I drink, if I had an alcoholic beverage, before bed or whatever, I'll get up usually about between 4 and 5 in the morning to go to the bathroom. And again, checking their labs, if their dihydrotestosterone is elevated, looking at the testosterone, if it becomes estradiol or if it becomes dihydrotestosterone, well, the enzyme that converts testosterone to dihydrotestosterone is 5-alpha reductase. Well, the conventional treatment is giving them, you know, Flomax. What I use is copper and zinc. Both those help shrink the prostate in conjunction with some saw palmetto. Now we're addressing the size of the prostate, and then with the cannabis, it helps them calm down, it helps them sleep, and so they're not having to get up as often or as frequently.
Gotcha. And when I mentioned quality of sleep, did you say it was the same or better, or like how would you say the quality of sleep would be compared to just not doing anything? I mean, obviously, if someone's like an insomniac and getting up all night, I'm sure like obviously the cannabis obviously can help a lot. But are they still getting in that REM like deep sleep from the cannabis?
Yes, they can get into that deep level of sleep, and like I said, people are measuring how they sleep, how well they sleep on all of these technological, their watches or
The
their
wearables. Yeah.
apps. Yeah. And they'll come in and they'll share that with me, and I'll see, what based on what their settings are set at, it gives us an understanding of how well they're sleeping, how deeply they're sleeping, et cetera. And so now they're not having to rely or go to have a sleep study. Now, do I still have to refer some people out for sleep studies? Absolutely, because a lot of people, it's not one size fits all. And as good as cannabis is, it's not a panacea. It's not going to work for everybody
Right.
the same way. And so, but nothing in medicine is that way. Yeah, my mom, for example, she's 84 years old. She just suffered a stroke in June of this year. Prior to that, she had had multiple transient ischemic attacks, mini strokes. Um, Granted, she's non-compliant. She's a really bad patient overall. But for the past 5 to 7 years, she's been suffering and dealing with dry eyes, just consistently, constantly having dry eyes. And she's been to multiple ophthalmologists, neuro-ophthalmologists, everybody in the same specialty. And about a week, 10 days ago, she saw a younger graduate ophthalmologist fresh out of specialty, fresh out of residency. And when my mom went to see her, her exact words were, I'm going to help you. I'm going to fix your problem. And my response to my mother was, and if she can't, like everybody else, what then?
Yeah.
To come in and boldly say, well, I'm going to fix your problem, you know, I can help your problem. I'll do my best to figure out what your problem is. But for me to arrogantly say, I'm going to fix you, especially when by the time they come to me, they've seen everybody and their brother,
Hmm.
because, not everybody starts with cannabis as their number one treatment of choice. Not
Sure.
everybody is going to see somebody for BHRT first. They're going to do everything else first. And then when they're sick and tired of being sick and tired, then they'll say, okay, well, I'll pay out of pocket to get fixed.
Yeah. I mean, I could just from personal experience trying like edibles and things like that, I can totally see how people who deal with, depression or anxiety, how it can help take the edge off for sure and get them, comfortable and feeling better. And I'm sure, like you said, everyone's a little bit different. I'm fairly sensitive to it. So like I know I have friends who can do 10 milligrams and I'd be I'd be done. I'd be done. I can do probably, 2 to 3 and it's fine. So it's definitely I can see how you have like a tailored approach to that. And then also the amount of CBD and THC that is in each application that you're using for the client. How do you sort of navigate that? I mean, now you see like these hybrids where it's like 50-50. How do you go about deciding the amount of THC versus CBD?
Excellent question. And that, again, was from personal experience. This I learned when I was in chiropractic school and a chiropractor, because as a chiropractor, all my patients had a get rich quick scheme. And everybody had a multi-level marketing product that I needed to try and sell to my patients.
Sure.
And my motto was the same for everybody. Give me a sample, give me a bottle, let me try it, and
Right.
I'll let you know how it worked on me. Or if it's something that, a condition that I didn't have, but I had patients that had it, I would gift it to one of my patients, say, look, I'm going to give you this, and that I knew they were compliant and that they were trustworthy. I give it to them and say, here, you try this. You tell me how it worked. And if it worked for them or if it worked for me, then I would consider it. If it didn't, I wouldn't. And I always knew when I was using cannabis that certain ratios, certain percentages didn't work as well for me as others. And I, at one of the seminars where I was speaking at, an individual that is an engineer, a geneticist, and an engineer. So he's like, one of these PhD geeks to the nth degree, created a program and a testing to be able to test cannabinoids and determine based on your genetic makeup what phytocannabinoids worked best for you, what type of cannabis, whether it was a high THC or a high CBD or a ratio-based product, was, what you needed. I uh, I use that in my mental health clinic when patients come in that have been on antidepressants for 10, 15, 20 years, and they're PHQ-9 there, which is the measure, an objective measure of depression is, 21, 24, 27, and they're on, three, four, five medications. I do a genetic test on them to determine how they metabolize certain medications. And
Mm.
once I get the results, I see, okay, every medication that you're on, your body can't metabolize. We have to completely change and revamp how you've been treated. And within 30 to 90 days, again, we turn lives around because of that simple genetic testing. So this individual came up with the same concept, but for cannabis.
Mm.
And when I did that, I discovered that I am an ultra slow metabolizer of THC, an ultra rapid metabolizer of CBD, and a normal metabolizer of ratio-based products. From that point forward, I stopped purchasing just high THC products or high CBD products. I started getting ratio-based products and then trial and error. I started with a one-to-one CBD THC. I felt that it gave me a little bit too much somnolence during the day, made me a little groggy. So I dialed it back to a 5-to-1 CBD THC. And every morning I take 20 milligrams of that, where 83% is CBD, 17% is THC, and that 5-to-1 ratio, and that carries me through. And I have a vape pen that is of the same ratio of 5-to-1. And so I'll have that with me throughout, that I can use periodically throughout the day. And as a result, that keeps me even and focused, and you know keeps my anxiety. And because as a physician, I mean, I see 24 to 30 people a day,
Mm.
and not everybody is as jovial and wanting to get well and be happy all the time. I'm going to get, you know,
Yeah.
angry people that are in pain, disgruntled, their insurance didn't pay, or which, cannabis doesn't, you don't use insurance for cannabis visits. And so, and we just had we voted in the state of Florida to be like
I just,
Illinois.
yeah, it
To,
didn't pass, right? Yeah.
no,
I,
it missed it by 4%.
oh
We
my
needed,
God.
because because it was a constitutional amendment, we had to have 60% or greater, and we got 56%.
Hmm.
And so as a result of that, adult use was stopped. And so all of these individuals there had all their cookies in that basket, hoping that it was going to become adult use. It didn't happen. And so, they had their issues and their traumas with that. And so to offset a lot of the personalities that I deal with, not only patients but staff, I use that, and it keeps me relatively, consistent. So that's how I dose and manage people. If I have patients, I mean, I have my go-tos and I have my ideas based on what patients are telling me, and based on all the years and patients that I've managed, not only in the United States but abroad. But when I get these complicated cases that no matter what I give them or how they're taking it, it's not working for them, those are the ones that I reach out to, my buddy in California and say, hey, send me one of your test kits. I got somebody for you.
Hmm.
And then we figure it out. In fact, today, because I'm one of the few doctors in the state that sees children,
I was actually gonna ask about that. Yeah.
yeah, I was the first certifying physician in the state of Florida to recommend to a 15-year-old. In fact, last week was the 8-year anniversary of him receiving a one-to-one CBD THC because he was terminally ill. He had a stage 4 cancer of the head and neck that had eaten out his jaw, his
Hmm.
cheekbone, his eyeball and eye socket. He had to wear an eye patch, had gone into his skull and then into his brain. And he was on 16 milligrams of morphine via a morphine pump. But, every 4 to 6 hours, he weighed maybe 100 pounds soaking wet. And in between, if he had any pain, which he obviously did with all that bone trauma that he had, he could give himself a bolus of additional morphine. But all he did was lay in his hospital bed in his bedroom, drooling, looking at his crotch. And once we got him started on the cannabis, within a month, we dropped his morphine dose from 16 milligrams to 8 milligrams, you know, which for mom and dad, that was huge because now he was no longer in his bedroom drooling. He was in the living room, enjoying the family, asking his mom, "Hey, mom, make me some rice and beans and meat. I'm hungry." Or, was the best man at his brother's wedding. And at that same wedding, he danced with his sister. And yeah, he did pass away the following year in February, but his quality of life from November to February is what everybody's going to remember in that family, in the church, in his society, in his community. And so today I saw a 12-year-old girl, same thing. She has ADD, ADHD. She's on the spectrum. So she would have some major meltdowns, and they were using over-the-counter CBD because, again, they read about, Charlotte, Fiji, and Colorado, and did some research, and so they started her on straight CBD, but she wasn't getting any results. And
Hmm.
so we started with the 1-to-1, and then that wasn't working very well, and then the 5-to-1, and we just couldn't figure it out. And we ordered the genetic testing on her. And today, when I saw her for her 6.5 month follow-up, mom, dad, and she were there, and we could do virtual visits for follow-ups in the state of Florida. Completely different girl. She was sitting there, very calm, very chill, and she's like, I don't take my ADD medicine anymore. I'm not on any pharmaceuticals, doc. I'm just taking what you've told me to take. I take a 2-to-1 CBD THC capsule during the day. I take a 1-to-1 or a 1-to-4 CBD THC, so a little more THC at bedtime to help her sleep, shut her brain down. Completely different
Mm.
child. And in the middle of our consultation, I'm seeing her like looking at her watch and looking a little antsy. I'm like, what's wrong with you? What's your problem? She's like, no, I got an assignment to do and I got to turn it in. I'm like, oh, I'm sorry, go do your schoolwork. And so
Mm.
mom and dad sat there, and they, when she left, they looked at me and said, 2 years ago, this was not the child that you just saw here saying, I got to go do homework. I got to do my assignment. So
Mm.
that's how I dose and manage a lot of the complicated ones.
Yeah, I gotta imagine like just like ADD and for example is just probably misdiagnosed or overdiagnosed, and then these kids get on on become medicated and on pharmaceuticals, and for to use something like this as an alternative to get them off that, I think is that something that you see that's becoming more and more common?
Very much so. Yes. Again, because as you said, the, they're in mental health, the diagnoses are very, very gray a lot of times. And, for years, we thought and we were taught that, oh, if they behave this way, then it's this. And if they behave this way, it's this. But now, things are changing. One of my favorite comedians and talk show hosts is Trevor Noah. And not recently, but within the past year, he's been more verbal about the fact that he was diagnosed with ADHD depression. And that's something that most people have never heard of. But more importantly, it's not treated with medicine. But the minute you hear ADHD or ADD, boom, oh, we got to give you an amphetamine. And that's where I laugh because conventional thought says and dictates that we should not give marijuana, cannabis,
Mm.
to a child because it's going to cause them to be schizophrenic and the probability of addiction and they can become addicted. Yeah, but amphetamine is way more addictive
Right,
than cannabis ever will be. What are
right,
you talking about?
right. It's just completely inverse of that. Yeah, does makes no sense. Yeah, I definitely. So in Florida, you have to have a like a medical card to get cannabis, or you have to have a doctor prescribe it. Is that correct?
Yeah, recommend it. We can't prescribe it because it's still a Schedule One drug. And
Okay.
so if I say I'm prescribing it, then that's a violation of the DEA. and I would lose my DEA license because the only way I could prescribe a Schedule 1 drug is if I have a special DEA license to do so. And that's usually reserved for individuals that do clinical trials, do clinical studies. So the rest of us use our First Amendment, our constitutional right of free speech. And so we make a recommendation. But yeah, in the state of Florida, the only way to obtain cannabis legally, because
Hmm.
there's tons of other ways,
Yeah.
but the legal way of getting it medically is by having a physician sign off and saying that you meet the criteria. In the state of Florida, we have 10 qualifying conditions that are named: post-traumatic stress disorder, cancer, HIV, AIDS, Lou Gehrig's disease or ALS, Parkinson's disease, Crohn's, multiple sclerosis, epilepsy, seizures, and cancer. But and then the 11th is a terminally ill patient, which is why the 15-year-old was able to get cannabis in 2016 because it was under the Right to Try Act, which meant that if you were terminally ill, and the state defined a terminally ill person as someone who, if we did nothing for them, they would be dead within a year. That's how they define terminally ill. So terminally ill patients, and but we have a caveat in the state that reads any chronically debilitating condition that's equal to or greater in severity than one of the ones named. So, for example, an individual comes in with irritable bowel syndrome or ulcerative colitis, I can put them under the umbrella of Crohn's. If someone comes in with insomnia, anxiety, depression, then I put them under the umbrella of PTSD. If someone comes in with diabetic neuropathy, peripheral neuropathy, or low back pain with pain radiating down both legs, then I can put them under the multiple sclerosis umbrella because it's comparable to that. And so that's how we work with the adult population. For children, and in the state of Florida, pediatrics are anyone below the age of 18. So up to the age of 17, they are eligible to get cannabis, but two physicians have to sign off on the patient. So we need two doctors to sign off on it. I get a lot of referrals from pediatricians, so they give me the first, you know, recommendation. I give them the second. We comply with that ruling, and then I manage their care together with the pediatrician. Where if they're already on some type of ADD, ADHD medication or some medication for their because they're on spectrum or their anxiety or whatever, uh, then we work together to wean them off or wean them down so that way they're not so dependent on conventional medications. And so that's how we manage pediatric cases and the adults.
Gotcha. Okay. And where were they would just get it from a local cannabis store and just they have a card or, with a
Correct.
recommendation.
Yes. Yeah, they get a medical cannabis card, and then they would go to a specific dispensary or one of the typical dispensaries because I'm pretty familiar with what each one of the dispensaries
Have.
has and what they offer.
Yeah.
And then if I've done the genetic testing on them, then it really hones me in to know which dispensary to send them to. Not that I can, quote unquote, legally say go here, because then that could be considered, an like a anti-kickback, because I get nothing from this. Because in the state of Florida, I cannot get any compensation from any dispensary. I can't even invest in
Hmm.
a cannabis dispensary in the state of Florida because that would be a violation. I cannot have any compensation from any dispensary. So I can invest in cannabis outside the state of Florida, but not of anyone in the state of Florida. And so when that happens, then I'll send them to a specific dispensary that I know will have the products and the product line that would best benefit them.
Gotcha. Okay. And like quality wise, like I know with like the supplement industry, it's sort of the wild, wild west a little bit. Like you got to really
Yeah.
know where you're getting it from. How is it as far as like medical marijuana? I mean, I'm sure there's some reputable brands that you probably recommend.
Well, not only that, but we do it's mandated that they do third-party testing.
Yeah.
And so, an independent, not their labs, but an independent lab. And every one of the products has to have what's called the COA, which is a certificate of analysis. And so, in that certificate of analysis, it has a breakdown of what's in there. So what percent THC, what percent CBD, what percent CBN, which is also an excellent phytocannabinoid for sleep, what percent CBG, THC for individuals that want to lose weight, because that was another thing. Oh, I'm going to get the munchies, and if I'm going to get the munchies,
Oh,
I'm going to gain weight, especially if, cortisol levels are up. You know that they've got that central adiposity, their belly, they got the belly fat. It's like, wait a minute, I don't want to gain more weight. And so there are certain terpenes, for example, humulene, that's excellent for controlling and managing your glycemic index, controls your blood sugar, but also addresses metabolic syndrome. And so that, in conjunction with THCV, which is a phytocannabinoid that has been shown to help uh, curb appetite, then we'll get products that have a higher percentage of those two if the person is wanting to monitor and control their weight. And today I saw a gentleman who his first line, he started off kind of negative. And so his first line is like, I always ask him, well, how have you been since the last time I saw you? That, well, about the same. I'm not cured. Like, this is like, marijuana isn't curing me. Like, okay, I don't know of anything that does cure, but that's okay. But then, like, the next sentence was, oh, but let me tell you something that happened, doc. I'm no longer on blood pressure medicine, and I'm no longer on my oral medication for my diabetes. I'm like, really? How come? Well, because just like you told me to take an edible, a specific type of edible at night to help me sleep, and to take another one during the day to help with my anxiety and my depression. I'm like, yeah. Well, I took an edible. I take an edible in the morning when I'm having my coffee and just chilling out. And my blood pressure went from 150 over 100 to 118 over 70. And I'm like, really? I'm like, yeah. He's like, yeah. And my blood sugar, my A1C went from 7.5 and now I'm 5.7. I'm like, well, that's practically normal. He's like, yeah. And my primary care couldn't believe it. And I said, well, what do you attribute it to? And he's like, well, what you told me, the marijuana. I'm like, so I guess you're not the same as you were 6 months ago,
yeah, no
because
kidding.
now you're not on these medications. And then he pauses like, oh yeah, I guess you're right. So,
Yeah, I mean, I can see so many different uses for it. Like you said, you listed off 10 of them. And I think, yeah, more and more people should try these alternative methods, as opposed to, just relying only on pharmaceuticals. There's a time and a place probably for either one, but like you said, like if you can wean off, you know, 5, 10 medications or whatever it is, that can only do you, be a positive.
well, when I speak abroad, and everybody wants to compare their healthcare system to the United States, you know, and my response is pretty much the same. In the acute phase, trauma care, I
Yeah,
would not want to be anywhere other than the United States
right,
or that. You know,
right.
if I'm going to get shot, I want to get shot like in, downtown Detroit or
Right.
or the Bronx, where I'm originally from, because I know that those physicians in those ERs,
Yeah.
that's their daily bread. They know what to do. They know how to do it. They're we or emergent acute care. There's no one better. Now, when it comes to chronic or long-term care, that's where we as a nation have dropped the ball. We are in sick care, not health care. And that's where we as a nation need to step up and do better. And that's what I see in other countries that, you know, are not as affluent or as industrialized as we are, that they have better
Mm.
healthcare because they know that if they get sick, they're not going to have the wherewithal and the resources to be able to manage what they're going to end up with. And so for that reason, there's got to be a balance between the two. And that's where, you know, I've learned so much by traveling and going to South America, Central America, the Caribbean, Europe, Southeast Asia, and working with doctors there, educating them, training them, but also working with the lay people and speaking with them. But my biggest laugh is when I get individuals that live in Canada, that are Canadians, that reach out to me for support with their cannabis treatment. I'm like, wait a minute. You guys have had a medical program since 2000. Your insurance pays for it. You can get your medication sent to you by mail to your home. It's federally legal in your country. My country, it's not that way. Why are you seeking my help? And their response is the same across the board. Most of the doctors that we see here either don't believe in it or don't know what they're doing or don't want to do it.
Hmm.
And I'm like, wait a minute. Why throw out the baby with the bathwater? It's like you've
Yeah.
got it. You've got access to it. Use it. Use it to your advantage. Like you said, there's times when you need conventional medicine, like, something acute, something that needs to be addressed right now. You've got it. Like, one of my nurse practitioner students reached out to me today, that she's had COVID 3 times, and now there's a possibility that she may have bronchial pneumonia. You know, I ordered a bunch of tests on her and all these other things, but initially, she's getting, you know, an inhaler, she's getting steroids, she's getting this, she's getting that, she's getting multiple antibiotics to address and treat the issue right now acutely. Once she gets better and once we get her out of the woods and we don't have to intubate her or put her on a ventilator or anything like that. Once we get past that, then she and I are going to have a major conversation about, okay, what are you doing and how are you doing it that you have gotten COVID 3 times? I mean, yeah, you're a nurse practitioner, you're in the trenches, you're, in the front line, but there's something else going on in your system that we need to get to the root cause of. And so that's where me having gone abroad and having been a chiropractor, one of the mentors in chiropractic school was a gentleman by the name of Clarence Gonstead, based out of Mount Horeb, Wisconsin. And he had a statement, and when you walk into his clinic, they had a big sign that read, find it, fix it, accept it, leave it alone. And understand that you're looking for the root cause of the problem, you're fixing it, and you're leaving it alone, and you let the body do the rest.
Yeah. Well, this is great. What would you say to someone that's maybe, has some chronic pain or maybe even just some depression, and maybe where they want to help manage stress? What's the best way to go about, I mean, like getting started with, cannabis?
Typically, and this is something I offer, which I see that you offer the same. I offer a free 15-minute consultation. They can go to my website, josephrosadomd.com. They can schedule a 15-minute appointment with me. They get me. They don't get my assistant. They don't get one of my nurse practitioners. They don't get my PA. They get me for 15 minutes, and I'll answer and address any and all issues and concerns at that time. And then if it's something that does work for them or may be a possibility, then depending on where they are, where they live, then, if they're in Florida, it's a no-brainer. They can come up to one of my clinics. If they're in Michigan, no-brainer because I'm licensed in Michigan. Michigan, I see more kids than Florida because, again, Michigan has the same ruling that you need to have 2 doctors sign off for medical cannabis. But they have, like, autism is a qualifying condition. OCD is a qualifying condition
Hmm.
in Michigan. And so a lot of children that are on spectrum, that their parents that are adult users or have a medical cannabis card have chosen to have their children get one as well. And so that's where I work with them. So Michigan, Florida, no problem. I can manage you there. But if you're outside of any one of those, one of the companies that I work with, we have clinics in different states. And so if they happen to be in one of those states where we have a presence, like Ohio, Texas, Georgia, etc., Massachusetts, then I'll send them to one of the doctors that I know or that are with the company there. If not, then we'll make it work.
Excellent. Yeah. No, this was great. This is a topic we haven't discussed on my podcast, and I'm, 400 plus episodes in. So I think it was, rightfully so, and something that needs to be talked about more. So I really appreciate you coming on. And yeah, your website's josephrosadomd.com. We'll definitely put links in the show notes for people to learn all about you. And if they want to reach out, they can do a 15-minute call, which is great. So,
Perfect. Thank you
yeah.
very much. And before we leave, I want to bust a myth right now. Call me the myth buster.
Yeah.
For years, and I'm sure you heard this too, that, oh, if you smoke marijuana, your testosterone level drops, or you're going to become impotent, or you're going to have erectile dysfunction. Okay. Cannabis is biphasic. What does that mean? At a low dose, it has one effect. At a high dose or higher dose, it has an opposite or different effect. So in men, if you use a lower dose, what we discussed earlier, a 2.5 to 5 milligrams, which is considered a low dose, anything less than 10 milligrams is considered a low dose, that increases the libido, that stimulates the sexual appetite. Anything beyond that, it has the exact opposite effect in men. In women, it doesn't matter. You can wave the joint over them and they'll get stimulated. With men, not so much. So be mindful of that. Yes, it does do it, but at a higher dose. At a lower dose, it does stimulate. And there are certain terpenes that also stimulate and open up. I went to one dispensary here locally, and they had a new product called Pink Rosé. And I'm like, what? Like there was advertisement everywhere, all over the dispensary. I'm like, you guys are really pushing and promoting this pretty aggressively. They're like, Doc, you're not going to believe it. And they showed me the insert, and one of the things that they took that it was promoting was increasing sexual appetite, increasing the libido. So I'm like, okay, there you have it. But then we both said it at the same time, at a low dose, right? I'm like, yeah, at a low dose. So yeah, at a low dose for men, definitely, no problems.
Well, thanks for crushing that myth.
My pleasure, sir.
All right. Well, thanks so much for coming on. Have a great rest of the day.
You as well. Have a wonderful evening, and we'll see you next time.
Thank you so much.
Bye-bye.
Thanks for listening to the Get Lean, Eat Clean podcast. I understand there are millions of other podcasts out there, and you've chosen to listen to mine, and I appreciate that. Check out the show notes at briangryn.com for everything that was mentioned in this episode. Feel free to subscribe to the podcast and share it with a friend or family member that's looking to get their body back to what it once was. Thanks again, and have a great day.